Hi, everyone, and welcome back to the YMyHealth podcast. I'm your co host for the day, Julie Woon, and I am excited to welcome Dr. Arnelle Wright, or on social media, the Daily Dentist, trained clinician from the University of Florida. And she has founded the Doctors for Future Doctors. She also leads oral health and wellness of Oviedo, holds
Mhm.
key leadership roles with the ADA and Florida Dental Associations, and she has earned numerous leadership awards, including UF's 40 Under 40 and FDA New Dentist Leader Honors. She's a sought after speaker, mentor, and co host of the ADA's Dental Soundbites podcast, and a passionate advocate for equity, leadership, and excellence in dentistry. So we're very excited to have her join to talk a little bit about oral hygiene today on the episode. So welcome.
Hey, thank you so much, Julie. I am so glad to be here. And to all of our listening audience, I am so excited to share with you today.
Perfect. Well, at Why My Health, I mean, we go through a ton of different topics, and dental care is one that I think maybe sometimes people might let kind of fall to the wayside when they're thinking about just regular checkups having maybe every 6 months or so.
Yeah.
And also, many millennials grew up with different dental care messages when they were kids versus today. So I was curious
Mhm.
if, just to start, we could talk about maybe some common mistakes that you see this age group making.
Yeah. So, you know what? Not having a dental home is the most common one that I'm seeing. And so, what that pretty much means is not having a designated dental provider. So, someone that you can call that you have an established relationship with, or that you're at least establishing care with, someone that you see on a regular basis, to your point about the every 6 months or so. That's around about, the most common time that if you're considered a healthy dental patient, meaning your gums aren't bleeding, you don't have a lot of plaque and calculus or tartar buildup, you don't have a lot of decay, need a lot of fillings, or need a lot of dental work, you're doing a pretty good job at home. We would see you in office every 6 months for the most part, right? But then there's this other group of patients who they have diagnosed, or more often than not, undiagnosed gum disease or dental disease, cavities, and things of that nature. So, for those patients who don't have those things, so one of the most common things that we're seeing is that this age group, they don't have a dental home. And basically, that means having someone to call, having an office that's your designated dental provider. So, if you have some undiagnosed gum disease, you're not knowing about it. And so, if you're not going in, you're only coming in on an emergent basis. So, pretty much when you have pain, pretty much when you may feel something that is weird, or if you taste something that's bad in your mouth, those are the only times that you're coming into the dental office. And so that's just one of the most common things that I'm seeing, is just not having that dental home, which opens you up to a whole world of dental problems, because there's just not someone who is taking care and keeping an eye on your x-rays. They're not examining you regularly. They're not, communicating with you regularly about your diet, or maybe even your lifestyle habits, or, just your at home care. There's so many things that we can talk about. I won't go into the bunny trail right now, but, maybe we can talk about some of those dangers or the harms in not having a designated dental home, later in the episode.
Yeah, I think I definitely want to touch on that. And I'm also
Okay.
curious if there's anything that changes with our teeth and our gums as we kind of move into, our 20s, 30s, 40s versus when you're maybe a younger person or a child.
Well, so yes and no. The thing about it is like we all know that hormones play a major role in everything, all aspects of our health. And so as you age, there are hormonal changes that we experience, especially we as women, we have some hormonal things. As you age, or as just grow and develop as a person, you may have changes to your systemic health, which may require for you to start taking new medications that your mouth is not used to. And there are certain manifestations orally that happen as a result of these new medications that you're taking, right? So, for instance, dry mouth is something that people experience when they take certain medications for blood pressure, or so, just when you're taking these medications, for example, for blood pressure, like I mentioned, if you have dry mouth, this is something that's new and it opens you up to now not being able to just naturally rinse your mouth in between brushing, in between hygiene, in between eating, drinking. And so now the bacteria that's inside of your mouth, the acidity changes inside of your mouth, and then that creates an environment where now you have an environment that's conducive to developing cavities. And so if you're not seeing someone on a regular basis so they can notice, hey, has your medications changed because your salivary flow is a little bit different than what I remember. And there's all kinds of tests, like something that we do here in my office is we do a salivary test. There are some times when patients come into the office and they may share a new experience or have a chief complaint of, I didn't have cavities growing up or when I was a teenager or early 20s, but now that I'm, let's say, 40, I'm starting to get all of these cavities. And my first question is to evaluate or ask about any new medications, any new diagnoses systemically that they're having, or anything that has changed with them medically. That may now be an oral manifestation that we're seeing inside of the mouth. And so, a lot of times from there, it will kind of make me say, well, before we just go and ignore this, or before we even just say, hey, let's get this filling, let's get this, I say, let's do a salivary test. Let's see what bacteria is found inside of your saliva that may be contributing to this, in addition to whatever else has changed in your body or with your medical, composition. And so those are some of the things that I really love to do. It's a different way of practicing, is really preventative focus, or it's just trying to be very investigative, and coming alongside of the patient, instead of just trying to drill and fill, which is something that we've seen in dentistry for many years, where, a patient just comes in, they have an issue, and we really don't even figure out the root cause. We just kind of go for what we know and what we were taught textbook and in the classroom, like, hey, if a person has this lesion, let's do a filling. Or if they have this reason, let's do an extraction and let's do all of this, as opposed to uncovering the many layers that has led to that situation getting there in the first place. Which goes back to my first statement about the importance of having a dental home so that someone can follow along this journey with you and uncover things as they arise.
Yeah, absolutely. I know we emphasize so often just like the preventative piece of
Yeah.
it and how important that is and holistic care as
Yeah.
well. And I know you mention a little bit about just also some like lifestyle habits and things that
Yeah.
you could be doing that could potentially be affecting your teeth. I know I, for one, am a big coffee and sparkling water drinker, and those can sometimes, yep. I know sometimes that might not necessarily be the best for your dental health. So maybe you can break down a little bit about those lifestyle pieces as well.
Yeah. So, I am one of those providers where I give my patients permission to indulge. Okay. So, because the thing about it is, no one wants to be told what they can or can't do, because we're in our humanity, we're just going to go against the grain and be like, you're telling me not to do that. So, I'm going to do it anyway. Right.
Yeah.
So, I give my patients permission to indulge. And just to be clear on what I mean by that, it's pretty much saying, I'm not saying that you can't have the candy. I'm not saying that you can't have the coffee or the tea or the sparkling water. Whatever tickles your fancy, enjoy. However, there is a frequency in which I want you to enjoy it, or a time of day around like when you're eating. So, from a nutritional perspective, and I do have a background in nutrition, right? So, from a nutritional perspective, this may not be the best recommendation, but dentally, there's a way to swing it. So sometimes we tell patients, if you're going to have like a soda, if you're going to have candy, if you're going to have a dessert, you're going to have sweets or your coffee, like you don't want to be sipping on it all day. You don't want to have a piece of candy or have, that cookie or that cake just in one sitting, or even the chips in one sitting. And then a couple hours later, you have another, piece of candy or another soda or whatever, because these are constant insults to your teeth, right? Instead, we say, hey, if you're going to have chips, have it with your meal. If you're going to have coffee, have it with your breakfast or as your breakfast. And then from there, you want to sip water throughout the day so that, your mouth is being lubricated and you're being hydrated bodily, but you're not constantly insulting your teeth. So that's what I mean by, I tell my patients, if you're going to have it, just have it, but have it in consumption or at the same time that you're having your dinner or at the same time that you're having your lunch or your breakfast, as opposed to it just being like little nibbling all day. Now,
Yeah.
from a nutritional perspective, like people that are like trying to lose weight and things like that, they say a whole bunch of little mini meals, but that's a whole bunch of mini like healthy meals throughout the day. You know what I mean? So those are typically like the things that are healthy for our bodies are typically things that are also good and nice to our enamel, nice to our tooth structure, our gums. And so those typically don't cause those insults. Whereas, like, our carbohydrates, our refined simple sugars, the coffee, the sweets, and everything else. And I also tell patients, why don't you have a straw? You know what I mean? Use a straw because that kind of like eliminates a lot of the insults that may be happening, to your teeth if you're just drinking something regular. Now, another thing that I haven't brought up is something like grinding your teeth. That's not necessarily a lifestyle habit, but it's something that you develop over time. And if you're not careful and aware of it, then you can grind down your teeth to the point where you're collapsing your bite. So you don't even have like the facial structure that you normally had. People tend to appear older once they've ground down their teeth through just clenching and grinding and not being aware and not, wearing a night guard or things like that. We can go into conversation about wine. We can talk about a whole bunch of other lifestyle changes or lifestyle habits, smoking and things like that. So for me, I'm like, I'm not going to judge you on what you do, but I am going to do my due diligence and share, hey, these are the risks of this type of behavior as it relates to your teeth. We can also talk a little bit about, your nutrition and your health as well, because I love the partnership between nutrition and dentistry, and nutrition and medicine as a whole. I appreciate that. So I kind of go into all of those conversations to make sure that my patients are well educated, they're informed, and really they feel like they have a safe space to, talk about the things that are concerning them.
Yeah. I loved your tip about the straw. I think on social media, and you're there, so you probably see a lot of this. I hear a lot
Yeah,
about different trends for dental
yeah,
care, charcoal
yeah.
toothpaste, oil pulling, whitening strips.
I
I'm very curious
know.
what, I guess, fact or fiction, what are the things that are good for us to be doing at home when it comes to dental
So
care?
all right. So I'm a woman of science, right? I love, and for everybody listening, I'm a woman of faith as well, but I'm also a woman of science. I'm a believer, tried and true science. So first things first, let's talk about like consumerism. There, you have to think about consumerism, especially from the place of social media, right? Social media has become like the biggest marketing tool. It is a place where anyone can get in front of a screen, they can promote a product because they're being paid to do it. I mean, some people may be true believers in some of these things, some people may have the results, but science does not support charcoal. It is very harmful to your tooth structure. And so the reason why I brought up consumerism first is because a lot of my patients ask me, well, why is it being sold in stores? It's because people buy it. And so there are people who they have the perfect messaging, they have the perfect tone, they have the perfect presentation, and they know how to sell. Let's just be honest. And so there are people that will buy it because they have made a believer, like the person that's presenting it has made a believer out of this person. And so that's the reason why it's going to continue to be marketed to people, because as patients, you just don't know what you don't know, right? So, which is why this is why I harp so much on having a dental home. And I've been trying to do some education now that I'm a practice owner with my community and people that follow me, and of course, my patient base on it's important for you to just have a trusted resource, someone who reads the papers, someone who is inside of the rooms where these decisions are being made and these discussions are being held with the experts, people who make these decisions that affect not only our profession, dentistry to be specific, but then our dental patients. So to go back to the top, I just kind of wanted to kind of like set it up really nicely. So charcoal, I am not a fan of that because of how harmful it is to your enamel. But at the same time, once again, I do not bash my patients for it. I really do try and take the role of coming alongside them. I educate them on the reasons why, but then I tell them, hey, these are the alternatives if you were to turn the page. Same thing with oil pulling. I have not seen any sort of results. I've tried oil pulling, and one, I don't even know how people can do it for that long. I'm just like, how do you keep this in your mouth for what is it? Is it 20
That's
minutes?
a long
A
time.
long
Yeah.
time. That's a long time to keep something swishing around, and, I mean, I don't have 20 minutes of time to even do that anyway. I'm like, "Listen, I'm good on the 2 by 2 rule, which is brushing and flossing twice a day for 2 minutes, 1 in the morning, 1 at night."
Yeah,
So, charcoal oil pulling, those are things that I don't necessarily support. However, I'm not going to turn a patient away because that's their choice of, their dental care. Now, when it comes down to having a problem, now we have to talk about why the treatment that you may need is going to be a little bit more expensive, why it's going to take longer, why your options may be limited because of the damage that has happened over time because of this, this choice. But that's something we cross that bridge when we get there. And I just kind of feel like we're in a day and age where, not to go political, but just to talk a little bit about legislation, where, legislation is playing a major part in this. And our patients, they're not only looking at this patient provider relationship from, that through that lens. They're looking at it through the lens of being a consumer and having a choice, and it's their body, it's their decision. And I'm like, okay, we have to understand how to walk this fine line. And so we can't just turn patients away. So which is why I take the more perspective or the role of still coming to the office. I still want to be your provider of choice. Now I want to be educated on the products that are on the market that you're buying off of Amazon, that you're buying over the counter, or that you're getting off of TikTok shop. You know what I mean? So now I'm trying to make sure that I'm inserting myself into those conversations because I think it's my responsibility as a provider because I'm the one that went to school. I have the training for it. But at the time that I went to school, this was not a huge this was not a huge business. So social media wasn't what it was today. It was becoming what it is today, but now it's a big marketplace, and this is where people get their information, and I feel like that's where I need to be.
absolutely. Yeah, I mean, you nailed it. I That's really our focus here at YMyHealth
Yeah,
as well. There's so much stuff out on social media that
yeah,
is just swirling, and so I
it
think
is.
having reliable, research-based health information is so, so key.
It's critical. Yeah. It's
Is there a point where, say somebody's, maybe not been making the best lifestyle choices or for whatever reason, they just haven't kept up with their checkups, where the damage is done? Or are there still changes somebody could make to protect their teeth in the long term, even if it has been a while of neglect?
years. Yeah, so let's see. All right. So the reason why I look off and I like sit back and body language is so important, right? Because
Yeah,
you can tell a lot from a person's body language. Okay. So I love like people watching as an aside, everyone. So the reason why I take a sigh is because the answer is yes, but the answer can also be no. And the reason why it's pretty much both is because it's on a case by case basis. So depending on the person, depending on their age, depending on how advanced the damage is, like how far gone it is, the damage could be done to a degree of their natural teeth. So we call it natural dentition, right? So the damage could be done to where I've seen younger people have to have all of their teeth removed, and then they have to have, as far as like a restorative process, and in order to be able to eat, speak, chew, smile, laugh, live, a nice life, good quality of life, right? They have to have dentures. And so dentures are what you think of like your grandma, someone that's like really old, really aged, advanced, they've been around for a long time. They take their teeth in and out of their mouth, and that's how they eat, right? But I've seen younger people have to have all of their teeth taken out. And so that could be considered the damage being done, like there's no way to recover.
yeah,
Depending on their bone structure, their tissues, they may be able to connect those dentures to implants. So to snap a denture in and out of your mouth, and it appears real. It appears like natural teeth you would never know, right? So for me, I don't consider that being the damage done. I feel like it's an unfortunate situation for that person because of their age and because of, the psychological effects that that could have on them mental health wise, emotionally. But once you get over that and you kind of find the silver lining, the damage isn't done because you still get to function, you still get to smile, you still get to eat, and you still get to enjoy life, right? And so then the flip side of that is for someone who is maybe more advanced, right? So someone who is older in age and they've possibly had to have all of their teeth removed. They may not be invested because they're so burdened down with the idea that they have to deal with this in the first place that in their mind the damage could be done and they will just settle for the dentures or maybe not explore what that next tier of a restorative option may even be for them. Does that kind of make sense? So like
Yeah.
I I'm a huge hope dealer. people people are just like always like you could make anyone believe that they could conquer the world, and I'm like, I do believe that's a part of my purpose because I feel like I can find the silver lining. Like I want to come alongside my patients whether they are 25, whether they are 95, and say, hey, these are your options now. The options for a 95-year-old and a 25-year-old, they may be a little bit different because of so many contributing factors. However, it's my duty to find an option and at least express that option to that person. So, to directly answer your question, it is a little bit of both. And I look at every single patient based off of the data that they bring through my doors and when they're sitting in the chair, their dental background, their health history, their fears, their anxieties, their past dental experiences, their diet, their emotional distress. Like I don't know. I don't know. I just feel like I've completely forsaken the perspective of being a clinical provider dentally, of just like, okay, it's very cookie cutter. Like they come in with this, they need to do that. They come in with this, they need to do that. And instead, I like to spend time and uncover the many layers of the onion, and just really provide comprehensive care. And I'm gonna say one other thing, and I'll let you jump in. So earlier in our conversation, you mentioned the word holistic. So there is a huge draw for even this demographic of people who may be watching and listening to this podcast, right? There's a huge draw towards holistic dentistry. There are layers to holistic dentistry, okay? This is like becoming like a big thing, especially with all of the people who are and they do have huge online presence, in the social media space. What I want to say about that, because people ask me, am I a holistic dentist? And so that pretty much means like, all right, so I'm anti fluoride. I will not, talk about all of these things and yada, yada. I did want to say, like, again, I don't bash those people, but one of the things that I love to do is I want to know what products are available. And I just like for all of my patients to know, and anybody who sees me as like a trusted advisor, as a trusted, dental educator, as a dental provider, all of these things, I want them to be informed on what this means for them. And so holistic, it could be WHOLI, okay? Or it can be HOLI. And I
Yeah.
think people do confuse the two. And so when I think about holistic dentistry, it's with the W in front. I like to look at your whole body health. I want to take your saliva into consideration. I want to know if you have diabetes or a past medical history of diabetes, because that has an impact on the longevity of my treatment and the healing capacity that you're going to come back with. So I want to be pretty much like mentally fortified for any problems that I can run into. And so it might sound a little bit of controlling, but I just like to anticipate any issues that I'm going to have. And so I do have a whole bunch of patients who they refuse fluoride or they decline fluoride, application, topical fluoride varnish, at their routine visits, and I say, okay. And then I ask them, I follow up that conversation with, tell me what products you're using at home. And then now I've added that product in my, the bank or my reservoir of products that are on the market. that the next time I have another patient in the office, I may be able to ask them about that product and I can kind of follow up. I can do research. I can read, reports on these products just so that I know what my patients are using because I'm not in the business of turning anybody away from my doors, like
Yeah.
I want you to come and I want you to feel safe in my practice, whether your beliefs or your decisions are something that I, teach to or not. I feel like I kind of take that respectful approach with all of my patients. So I just kind of wanted to add that little piece in there.
No, that's great, and it's a perfect segue as well because I wanted to spend a
Awesome.
little bit of time talking about your work and your practice, and
Okay.
you've created an incredible organization to support women in dentistry, which I
Yeah.
wanted to touch on. So could you tell us a little bit more about that and what inspired you to start it?
Yes, absolutely. So I am always creating and building something. I really feel like one of my gifts and contributions to the world and the people that are in my sphere of influence is just giving them a different mindset. So, the organization that you're speaking about is Dental Femme. And then in the intro, something that you mentioned was Doctors for Future Doctors. For the longest time that I can like think back to, I've always had a mentorship energy. So I've always been big into showing someone else the way. And the reason why is because of my upbringing. So for anybody who knows me, you've heard, and for anybody who doesn't know me, this will be, like an introduction or you'll know understand a little bit why I am the way that I am. And so growing up, I didn't really have much dental care. Our family did the best that they could. Like my mom did the best that she could. She's a single mom for a couple of years. I have a stepdad. But for the most part, she's kind of like carried the weight for us. But thank God, she remarried and things like that. But growing up, I just didn't have very much. And so once I decided that I wanted to be a dentist, which is a whole nother story that we don't have time for, we'll just have to do a part two and come back and talk about it. But once I decided that I wanted to be a dentist, I realized how much I did not know, how much I needed to learn not only about the profession, but about getting into the profession. So the timeline of applying, right? And so there was a few times where, like throughout the process of me becoming a dentist, I didn't get accepted into dental school right away. So I'm very much so what you consider a non-traditional dental applicant, right? So I applied after I was like graduated from undergrad. I did a master's degree. While I was waiting to get into dental school after my master's, I taught school and so that goes back to that mentorship, that teacher educator energy that I talked about a few seconds ago. It's really important to me, and I learned through teaching in the public school system that I really love creating like a blueprint for anybody who's coming after me, anybody who has any glimmer of hope or they aspire to do anything big. I'm like, okay, let's find like some steps because there's so many steps that you need to learn along the way. And I mean, there's people who want to show these things to you, but frankly, everybody's busy. Everybody has a life. Everybody has something that they want to contribute, or that they're trying to focus on in their own personal life. So to directly answer your question about the dental femme and doctors for future doctors, excuse me, is I created those organizations because there were a group of women online, and I feel like mostly younger women, minorities, people who are from low SES backgrounds, people who have non-traditional pathways into whatever, of course, dentistry is like the main focus because that's what I can speak to the most confidently. I felt like those people always gravitated to me online. And so the Doctors for Future Doctors mentorship group, that's pretty much something that I started around about the time of COVID. And I enrolled a group of young women that were all across the country. They were in undergrad or they may have been non traditional students. And they just had no idea about the timeline of getting into dental school, what they needed to do, who they needed to talk to. Now, in the defense of ADEA, so ADEA is the American Dental Education Association. That's pretty much the organization that kind of helps guide you through the applications process, right? So ADEA, they provide all of this stuff online, but sometimes in our social media world, there's a gap where the students may not necessarily go to that resource, although it's available they may want to see and like kind of talk to a person that they can relate to, if that makes sense. And so I said, you know what? I want to fill gaps. And so that's pretty much why I start these organizations and why I love to build, strong groups for women. And so for Dental Femme, these are the women that are either early in their career, they're about to graduate dental school, or they're already practicing clinicians and they want to transition either from an associate, from an employee, from working wherever they have started working, and they eventually want to be a practice owner or they want to do something entrepreneurial. So I'm in many different spaces. I do, as you said in the introduction, podcasting. I am showing up online. I am doing all of these things with the American Dental Association, with the Women in DSO. So, like, I've some kind of way found myself on both the professional side, so practicing clinical dentistry in my day to day, so 9 to 5, Monday through Friday. And then some kind of way, I'm also involved in the industry side of dentistry, which is an untapped like resource for dental providers. And so I wanted to fill that gap and show people that you don't only have to be a clinician coming into work like for your 9 to 5. You can also make waves by showing up and speaking and sharing your story, because the only way that these organizations and the industry side thrives is if they have people that are at the table who've experienced it firsthand. So I don't know, I'm really big into mindset. I love to share my thoughts, my dreams. I love to share my failures, because I feel like there's not enough people online who they're trusted resources, but they also share the failures and what hasn't worked out well for them. And I just really believe that in order for me to show up authentically, I have to pull off the mask and I have to show people, like, look, I didn't get into dental school on my first try. Like, I had to retake the DAT. You know what I mean? Like, I didn't have all the money even to buy a huge practice. You know what I mean? My first practice, it's not huge, but you know what? It's beautiful. It's charming. It's mine though, and nobody in my family has ever done this. So I'm changing the generation and my family tree through small steps. And I'm also sharing this with the world, and the people in my world in real time as it unfolds, so that they'll know, like, hey, I can relate to that because this is something very similar. I don't have anybody who could like just write a check and put me into a practice. So I really just want to be that conduit and that person that shows the real, online, but as it's unfolding. And I think that's the reason why, like, I don't know, I'm so supercharged to start these organizations and build them.
Absolutely. I
That was
mean,
a
I
long
love
answer.
that. I love the authenticity though, and I think it's
Yeah,
great. It's
thank you.
yeah, it's so inspiring, I guess. Is there any one moment you can think of where it was like, "Yes, this is why we need this community. This is why I'm doing what I'm doing."
Yeah, you know what? Once I decided that I was gonna be a practice owner, it this has literally changed even my messaging. So now I won't be rebranding, but I'll definitely be like, my messaging will be super crystal clear on all of the things like I wish I had known at this stage in my career. And this is a great stage because I've been a dentist since 2017 is when I graduated dental school, right? And so I started working in the corporate space. And a lot of people, depending on who you speak to, there's a lot of like, resentment and just kind of like a ill feeling towards any dentist that works in like a corporate setting, right? And so for me, surprisingly, I was able to kind of marry the two, still be very engaged in organized dentistry, which a lot of private practice dentists have traditionally or historically been at the forefront of, right? But I was always wanting to make sure that I was in those rooms, at the meetings, at the conferences, sharpening the saw, like meaning getting better clinically and as a leader, in my profession. But and I didn't even plan on being a private practice owner in real life. Like, I wanted to own a practice, but I thought that I was going to buy into an existing corporate structure, which is where I was working, for the first part of my career. And so when this opportunity came, I was like, oh my gosh, I am learning so much about being a business owner. But had I not had that corporate experience, it was the perfect setup for walking into a situation as an owner because I was already engaged in, ownership mindset, leadership mindset, delegating, looking at reports, understanding how I'm compensated, understanding how my performance is judged or viewed. And so those are all the things that I bring to the table now as an owner. And so seeing that and just kind of living in it in real life makes me say, okay, yes, dental femme is definitely something that needs to exist because there's so many people who have stories that they don't tell. So if you want to become a podcaster, like that's one way that you can tell your story and you can impact the people who are drawn to you through a simple podcast, through audio while they're on their commute to work or while they're walking their dog or while they're cleaning their house or cooking dinner or just any kind of way, right? You can show up online and a lot of people they want to have a brand. I just happened to be building my brand while I was in dental school, not even knowing that I was building my brand, but now I'm intentional about building my brand. You know what I mean? Or like
Yeah.
adding to what's out there online. Now I'm intentional about the messaging that I have or that I speak online. And so, but before I was just showing up regularly. So I really just want to, again, this is that blueprint where it's like, hey, these are your how to's, or this is how I did it. These are the resources that I'm bringing to you. And I'm not the expert on everything. And this is something critical for the listeners to know about this, anything that I create. I really believe in collaboration. And so if I can find an expert, somebody that's in my network, because they say your network is your net worth. So if I can bring someone to the table to be like, hey, you're the expert on this. You taught me this. Can you please bring it to these women over here? That's what I want to do. So I really just believe that like my true calling is to be a conduit, and not for me to be the huge expert on everything. Because when you're an expert to everything, you really are an expert to nothing.
Yeah. Great. I We could talk about this for so long, and I
I
think, like you
know.
said, we need to do a second episode, but
We have
I
to.
wanna end on this high note because it was so
Okay.
lovely.
Thank you.
But yeah, thank you so much for coming and speaking with us. This has been such a
Yeah.
great time, and I wanted to leave just a few seconds here at the
Yeah.
end. If people wanna learn more about you, the organizations you work with, your practice, social media, where can people find
Yeah.
you?
So, you all, I have a few things to share. So, my practice is Oral Health and Wellness of Oviedo. I'm in like the greater Orlando area, but Oviedo is a town that's really close to Orlando. So, Oral Health and Wellness of Oviedo, and our Instagram handle is at Oral Health Oviedo, just to keep it short, so you don't have to type a whole bunch. But if you want to connect directly with me, I'm at the Daily Dentist, where I've been for a very long time. That is my baby. I love showing up as a daily dentist. And you can connect with me on LinkedIn. I'm LinkedIn/Arnelle Wright, DMD. That's ARNELLEWRIGHT, my credentials. I am also on Facebook. I have a very small presence on TikTok, but now that I'm in the practice ownership role, my goal is really to expand my reach through TikTok because a lot of, the younger consumers of content, that is where they hang out. Whereas, I'm an older millennial. So we were hanging out on Instagram. It
Yeah.
used to be Facebook, but it got a little too crowded. So I use Facebook a little bit different these days, especially now for the business. But also, if anybody wants to connect with me through email, you can always like privately DM me on Instagram. You can email me, thedailydentist@gmail.com. And my organizations that I mentioned, if you are interested in, coaching or speaking or webinars and just really learning and kind of picking my brain a little bit, I love doing webinars and I post videos through the Dental Femme network. So if you look up Dental Femme on Instagram, that's something. But honestly, you can just reach out to me in any way, shape, or form. And I would be so glad to, connect with you and, book a call, schedule some time, just so that we can unpack and see what your needs are.
Amazing. Well, that was
Yeah.
great. Thank you so much, Dr. Wright.
Thank you, Julie. This was really wonderful. And I'm so glad to have been a guest on your podcast.
Excellent. If
Mhm.
you're listening right now or watching on YouTube, and you've liked this episode, please like, subscribe, review. It's always helpful and it helps other people find us as well. We also have a survey going right now, and you can find the link in the show notes or in the video notes to get feedback on episodes and topics that you want to hear more about. So it takes no longer than 3 minutes. If you've got the time, we'd be greatly appreciative. But otherwise, we will see you or hear you in the next Why My Health podcast. Thanks.